This young man has a history of Menieres disease in the right ear, which has plagued him with frequent episodes of severe vertigo since 2013. That's 6 years ago, and has tried numerous treatments, including dexamethasone perfusion, without any improvement. He saw me a few months ago and had, it was noted that he has chronic headache, and his headaches were never of particular interest to any of his doctors, and he had just learned to live with them. So we put you on some propranolol, which is generally well tolerated by young men with headache, and you have, I think, had tolerated it really well and had a good response to your headache. Can you tell us what your Menieres disease was like before and what has changed?
Before, it wouldn't go away. It was a headache that lasted all day. And it wasn't super debilitating, but it was a bit debilitating enough that I couldn't work. I didn't want to get up. It was just this pain on the side of my head and face.
At the same side as your Menieres disease?
Yes, same side. It made it hard to think. It made it hard to do anything.
And how frequently were you having episodes of vertigo?
Almost daily, and it was bad. They'd last all day, or if I was lucky, only a few hours.
Now, you lost a substantial amount of hearing. The hearing on the left, fortunately, is normal, but on the right, the hearing thresholds had gone down to down more than 60 decibels.
That's correct.
And your word clarity had gone down to 70% in that ear. So there was a dramatic difference between the ears. But how long did it take after you started the propranolol for your headaches to go away?
Almost immediately. I started them that very next morning. I noticed the headache started to go away within hours. And then I started at 8 o'clock. By noon, the headache is gone. And then the ringing would subsided, and it probably took a few days for the ringing to subside to as much as it is now. But I mean, it went from a freight train to maybe it's just a normal ringing now.
Well, your hearing improved by 30 decibels, and your word discrimination is up to 100%, and you've stopped having headaches and episodes of vertigo.
Yeah.
I have to say that I'm delighted that you responded so well to the propranolol, but that is a much faster response than most people should ever expect from that kind of medication. Sometimes it takes weeks or even more than a month to respond. So we're delighted for your experience and sharing your story of improvement in Menieres disease by treating the underlying migraine. This suggests that for some patients, the inner ear is an innocent bystander and gets injured by migraine. And when we control the headache, then we stop injuring the ear and stop having the Menieres type attacks. So you actually came today to have another dexamethasone perfusion in your ear, but we decided not to do it because you're so improved.
Yeah.
Well, thanks for sharing your story with us.
Appreciate it. Thank you.